In your health headlines tonight, are you always blushing and have thick, bumpy skin? Those are signs of rosacea, which is a chronic disorder. Here with us now, as always on Tuesdays, is Dr. Mitchell Goldman from UCSD to talk about how to treat it and also some of the signs. Thanks for being here as always.
Always good to be here.
I was doing some reading on this, and former President Bill Clinton, Lady Di, Princess Diana, Mariah Carey, this is a pretty common condition. How many people do suffer from it?
It is. It's about 16 million Americans, mostly in people that are over the age of 30. And it comes from basically Scotch-Irish heritage. So the Irish did get around and they spread their genes everywhere.
So I've heard. That is my heritage.
And so although 33% of all Irish people have rosacea, it really is in British people and people of all races.
And this is National Rosacea Awareness Month. So let's talk about some of the signs that you actually have this. And it's not just that you're fair-skinned or something. You've put together a list here, and we have it on our screen.
Yeah, there's a list of 7 signs. Flushing, of course, is one of them. If people flush a little bit more, they develop a persistent redness. And the redness occurs from lots of trigger factors that we'll talk about. But then they get a lot of acne. And so as adults, it's not regular acne. It's called acne rosacea. What eventually happens is you get visible blood vessels, like in this gentleman, and then it can affect other parts of your skin. It can affect what's called the conjunctiva of the eye, and so you can get red bloodshot eyes. The skin can be really stingy, and in the very end you get what's called rhinophyma, which is a thickening of the skin, especially in the nose area. That's like what W.C. Fields had, and actually our former President Bill Clinton had a little bit of it too.
So what are some of those triggers that you're talking about?
It's basically things that cause a dilatation or expansion of the blood vessels, and that would be heat, caffeine, hot and spicy foods, sun exposure and stress, and of course alcohol. And what really brings people into my office is their friends think they're drinking too much alcohol, and it has nothing to do with alcohol. Really, alcohol is just a trigger. It doesn't, if you have a red flushy face, it doesn't mean you're an alcoholic. It just means you have rosacea.
All right, so how can we treat it? Because back in the day, there were very few things you could do, but now there's a whole gamut of things.
There really are. You know, the standard treatments are antibiotics like tetracycline, and also topical medications, one's called Metrogel, but they don't really work all that well, and I always hate putting patients on antibiotics. So we have a variety of lasers that really work. There's something called the intense pulse light, and the intense pulse light will actually get rid of all the redness, calm the oil glands down, and really put rosacea into remission, for, like in this gentleman, for up to 6 months or so. There's another procedure, a little more advanced, called photodynamic therapy. And with that procedure, it's usually we're treating more of the oil glands. But you can see this very lovely lady and this
how many
guy,
treatments do you need to get results like that?
You know, in this gentleman, it actually took 3 treatments to get him really great. But in most patients, it's just, I tell patients 1 treatment every 6 months, almost like going to the dentist and getting your teeth cleaned. You're going to have rosacea the rest of your life. It's in those genetics, somewhere coming from the Irish heritage. And so if you just come in every 6 months, we can definitely keep it under control with a variety of different laser treatments.
Well, I'm glad to know it's not the Guinness or the whiskey, so we don't have to blame ourselves too much for that. Thank you so much. Very interesting, and a lot of people have it, as I mentioned, so pretty common.
But we've got great
incident.
ways to treat it.
All right, certainly do. Dr. G every Tuesday, Andrew. Next week, we're going to tackle skin cancer because May is a time to certainly look at that.
Yeah, very important subject there. Thanks both to you.